Hi again. I'm Dr. Betty Robin, an attorney, dentist, and practice cell broker in Orange County, California. This is Dr. Robin Straight Talk, my opinion on questions or issues I'm commonly asked about. I formed these opinions after 25 years in the practice transition field as an attorney and a broker, and about 10 years before that as a practicing dentist. Today we're going to talk about a call I got. I got a call last week from the son of a dental school classmate of mine, and he was a newly licensed dentist. His dad told him to call Betty in response to his questions. Now, I'm pretty sure the dad knows the answers to all the questions his son was asking me, but I guess the cold, hard truth comes better from someone else. So here we go. This new dentist was already disillusioned about dentistry after less than 2 years out of school. His question for me specifically was, do you have anything for sale in the beach area of Orange County so I can take home at least $400,000 a year? I knew this was a loaded question, so I asked more. Why 400? What's going on? His response to me was that he needed that much to live, and he had no idea that they, meaning the IRS and Franchise Tax Board, take so much money out in taxes. So he wanted to end up after taxes with about $20,000 a month to live on. He said, I'm only making $12,000 a month as an associate, and that is unfair. I can't live on that, so I need to buy something now. So really, his specific problem was how much money he was making, and right now as an associate. I thought it was way too soon for him to be buying, which I told him, and we continued along the path of how to determine whether his associate compensation was fair. So how much should he be making, and what do I base that on? This is far from the first time I've got this question or some version of it. So many young dentists are pretty deluded coming right out of school about how much money they're going to make and how hard it is to actually make that money. Hear ye, hear ye. A degree does not guarantee you an income. Maybe it used to, but it certainly doesn't now. And it's very hard to make money. In my opinion, how much you should make as an associate depends solely on how profitable you are to whoever hires you. Let me repeat that. You got to eat what you kill. Let's start with the obvious. Dentistry is not a job where you get paid to show up. I don't know exactly why this young dentist felt his compensation was unfair, except he didn't have as much money to live the lifestyle he wanted to. But I reminded him of this fact, and I don't really think he ever thought of it that way before, that he had to be productive to a certain level to get paid a certain amount. Also, a job isn't like dental school. It is not a place where you get more training. Although this usually happens by default, still, the people hiring you expect you to be fully functional and produce. So, the more productive you are as an associate, the more money you're going to get paid. Period. But there is a second prong to this, and probably the most important prong. I have this dentist also tell me, well, the problem is my boss. I could cut 100 crowns a day if they would just feed me patients. Hello, you have to have 100 patients willing to let you cut 100 crowns a day and pay you for that privilege. So being a dentist comes down not only to your skills and services, but also to your ability to connect with patients, get patients to trust you, and get patients to hand over their very hard-earned money and actually let you work on them. This is why the most highly producing dentists who have the best practices have also the best skills with their hands and the best communication skills. But let's back up. Generally, a dentist hiring you can afford to pay you somewhere between 25 and 30% of what you produce. Well, not really your production, but your adjusted production. Adjusted production means that what the practice can actually plan on getting for the service. As an example, if the fee-for-service price for a crown is $1,500, but your boss is only getting $700 for that crown from a PPO, he or she can only afford to pay you 1% of that $700 they'll actually receive. Make sense? Now, I'm not a fan of the general dental associates being paid on collections because it's not their job to collect money or to figure out copays or deductibles. It is only their job to perform the service. But I am a fan of the general dental associate being paid twice a month on adjusted production, and it is the office's responsibility to know exactly how much that is and to collect applicable copays and deductibles. Back to the percentages I think are appropriate. The reason a dental practice can usually only afford to pay an associate dentist somewhere in the neighborhood of 25 to 33% of adjusted production is because of their overhead, and secondly, because they need to make a profit. I say need because they aren't doing this to help you or support you. They're doing it to make money. They're in business after all. All of this does depend largely on the practice's overhead, their practice model, and many other factors. But what I'm saying are averages of what I see out there. Many dentists are paid a base and then a percentage of production, again, adjusted production, after that base is met. But bottom line, that total, in my opinion, should generally not exceed 25 to 33% of the associate's adjusted production for it to make sense to the practice hiring you. Let's go back to the new dentist who told me he was salaried at $12,000 a month. I asked him what he was producing and he didn't know. I think all associates need to know that number on at least a weekly basis. So I told him, in order to determine whether your pay is unfair, you should be producing over $48,000 a month. So since he didn't know what he was producing, we didn't know if it was fair or not. The fact someone wants to make more money doesn't automatically make them more valuable. And he understood this now completely. But if he is producing more than the hypothetical $48,000 a month, then he had good information to go back to his owner with and ask for a raise, or ask to be transferred solely to a percent, or some combination of both, or to find another job. Kind of even hard to find another job if you don't know how much you were producing at your last job, in my opinion. That's your biggest selling point. So, to sum it up, and only my opinion, I know there are a million exceptions out there, but here's what I think. Number one, you only get to eat what you kill. It's a fact of life. Number two, associates should be paid every 2 weeks on their adjusted production. Number three, associates should not be paid on collections since it isn't their job to collect the money. Number four, general dental associates should generally be paid in the neighborhood of 25 to 33% of their adjusted production. Number five, it's quite clear after the Dynamex opinion from the California Supreme Court last year that paying your associates as employees is the only appropriate way to pay them. But consult your own attorney on that. And number six, lastly, in California at least, covenants not to compete are not valid for associate dentists. So we're going to talk about more issues with an associate, like when you should buy a practice after graduating and associate positions after you sell your practice in upcoming podcasts, so I don't want these to get too long. I know there are exceptions to everything, but I'm trying to talk the norm here in these podcasts. If you have any questions you want me to address in this podcast forum, you're welcome to email me at drrobin@bettyrobin.com. And you can tell me what you don't agree with as well, and I may discuss all of that on upcoming podcasts. Please subscribe to Dentistry Rising on iTunes or Stitcher. And this is Betty Robin again, and thank you so much for listening.